Good morning, welcome to Roger Dermatology. My name is Kanvo and I will be your nurse today. Let me tell you a little bit about the Mohs surgery and why it is widely used nowadays. The goal of the surgery is to remove skin cancer as completely as possible and to prevent recurrence. It is known to be the single most precise and effective treatment, especially for many basal cell carcinomas and squamous cell carcinomas, because Mohs surgery had high skill rates and provide best cosmetic result for the patients. From the biopsy of the site on your cheek, you have been diagnosed with basal cell skin cancer or BCC. BCC involve abnormal uncontrolled growth that arise in the skin basal cells, which lie in the deepest layer of epidermis, the outermost layer of the skin. It often results in open sores, red patches, shining bumps, or scars that are usually caused by intense and occasional sun exposures. Your surgery today will be performed by Dr. Timothy Rogers, a board-certified dermatologist and fellowship-trained Mohs surgeon. In terms of the process, first we are going to inject a local anesthesia to numb the area where you had your biopsy after it's been marked. Then Dr. Roger will remove a thin layer of visible cancerous tissue on your cheek. Then your wound will be bandaged temporarily and you can relax while waiting for the lab analysis. We will check the tissue under the microscope and a map is drawn indicating the precise location for any remaining tumor. You are then brought back into the operating room and additional anesthetic is injected to remove another layer of the skin where cancer cells still remain based on the map. Then the lab would begin again and the entire process is repeated as many times as needed until there are no more cancer cells. Once the site is clear of all cancer cells, we will close it with stitches because we will chase the extent of the tumor very carefully to minimize the removal of normal and healthy tissues. The Mohs surgery will be performed in stages which may last for 3 to 5 hours or much longer depending on the severity and depth of the cancer tissue. Besides, it is important for you to understand that every surgical procedure produces some kind of scarring. While we will try our best to leave the smallest scar as possible, it is also your responsibility to carefully follow the doctor's instruction for wound care and scar care to achieve the best outcome. You are expected to clean the wound gently. Please do not physically disturb the healing wound by any kind of massage or makeup application. You should avoid applying sunscreen as well as exposure to the sun because the action can irritate the wound. And finally, it is necessary for you to get regular screening by your own dermatologist after the next follow-up for your stitch removal. Since it is the best to have your stitches removed after 2 weeks, I am going to schedule your follow-up on Friday on October the 20th if it's suitable for you. And now, just relax, stay comfortable and wait to be calm for your surgery.